Hello everyone. So in this video I am going to discuss about the diuretics. So first we have to know that what does the diuretics means. So diuretics means di means two. So it is causing the loss of both two things, means two things it is losing. So what were those two things? So those two things were the sodium and water. So diuretics means it causes loss of sodium and water in urine. Sodium and water in urine, it causes loss of both the sodium and water in urine. While the another term, that is aquaretics, so what does aquaretics mean? So in the aquaretics it means that it only and only causes the loss of aqua means water, so loss of only water in urine. So it only causes the loss of only and only water in the urine, while the diuretic causes the loss of both sodium and water in urine. So how the diuretics acts? So diuretics is classified on the basis of the site of its action. So suppose this is our kidney and this is the functional unit of the kidney, that is the nephron, and here in the, as we all know that it is a glomerulus Bowman's capsule, PCT, it is the PCT, loop of Henle, DCT, and the collecting duct. So acts, so diuretics classified, diuretics classification based on site of action. Like first the diuretics which were causing the osmosis. So first one is the osmotic diuretics, which I will explain in this video, the osmotic diuretics. Second one is the diuretics acts on the PCT. The third one which acts on the loop of Henle, and the fourth one diuretics which act on the DCT, and the fifth one that acts on the collecting tubules. So that's act on the collecting tubules. So in this all the diuretics which here I am going to explain. So first today I am going to explain about the osmotic diuretics, means osmotic diuresis. So in the osmotic diuresis, what does it mean? So here the drug, only one drug is it in the osmotic diuretics, that is the mannitol. So mannitol drug causes the osmosis diuretics, means when this drug it is flowing in the blood vessels, it absorbs all the waters from the surrounding tissues. So that how it acts, by acting as the osmosis, it is causing the osmosis. So suppose this one is the blood vessels in which blood is flowing, and here the surrounding tissues were there in which there is water. So what does this drug do? It absorbs all the waters from the surroundings. So it absorbs all the waters from the surroundings. In this way osmotic diuresis is used. So where we can use these drugs? So we can use these drugs in cerebral edema, Second one, it is used in the acute attack of glaucoma, especially in the closer angle glaucoma. The third one is in the incipient renal failure. So this drug we can use in these conditions. Now what osmotic diuretics have one property, that is it attracts the water. So water attracting property is in the osmotic diuretics, that is water attracting property. So water attracting property is there. So in this these drugs, why the water attracting property this drug have? Because these drugs freely filtered from the glomerulus. So these drugs freely filtered from glomerulus. These drugs should not be reabsorbed. Once they get absorbed, so they will never reabsorb. So these drugs should not reabsorb, and also these drugs have the chemical inert property. Chemically inert property means these drugs does not produce any chemical reactions, and these drugs exert the osmotic effect. These drugs exert the osmotic effect. Now what were the contraindications where we will never use the osmotic diuretics drugs? So the contraindications of these drugs were like, in the active cerebral hemorrhage we never use these drugs, because once the drug crosses the blood vessels, then it attracts more water. So in the cerebral hemorrhage the water gets accumulated in the surrounding tissue. So that's why in the active cerebral hemorrhage these drugs were contraindicated. And also in the renal failure, also like acute renal failure, these drugs is contraindicated in acute renal failure. These drugs are contraindicated. The third one, in the pulmonary edema, also these drugs are contraindicated. Wherever these drugs cross the blood vessels, in those places these drugs are contraindicated because it causes the more water attract and the water gets accumulated in the surrounding tissue in spite in the blood vessels. So that's why these drugs are contraindicated in the other places. So that's all about the osmotic diuretics. In the next video I will cover the drugs acting on the PCT tubules. So I hope this video will help you.